My name is Dakota Yasso. I'm currently a second year nursing student, and this is Assessment 3 for SNUG331. My infographic focuses on COVID-19 and is designed for aged care residents. I chose this audience because they are at a greater risk of contracting COVID-19 and developing serious complications. The Australian Centre for Disease Control identifies older adults and aged care residents as a high-risk group, highlighting the importance of targeted health education for this population. I used generative AI, specifically ChatGPT, to gather initial information about COVID-19, including its prevalence, symptoms, and prevention strategies. The prompt I used was COVID-19 Prevalence, Symptoms, Prevention. I then reviewed the information provided and conducted my own research using reputable health sources. ChatGPT provided information sourced from organizations such as the World Health Organization. For example, it stated that nearly 780 million confirmed cases and more than 7.1 million deaths had been reported globally by late 2025, and explained that COVID-19 is a contagious respiratory illness caused by the SARS-CoV-2 virus that spreads mainly through respiratory droplets and airborne particles. It also provided information from the United States Centers for Disease Control and Prevention, including guidance that testing can help confirm infection and reduce transmission, and that early treatment is important for people at higher risk of severe illness. Through this process, I found that the information gathered by AI relied heavily on international sources, particularly American organizations such as the CDC. This highlighted a limitation of my original prompt, as I did not specify that I wanted information relevant to Australia. As a result, I conducted additional research using Australian sources, including Health Direct and the Australian Centre for Disease Control, to ensure the information in my infographic was appropriate for the target audience. After comparing the AI-generated information with my own research, I found that the information provided by ChatGPT was generally accurate and covered the key points I identified independently. However, it also included additional information that was not directly relevant to my infographic. This demonstrated that while generative AI can be a useful starting point for research, the information should be verified against reliable sources and adapted to suit the intended audience and context. During my own research, I searched for specific information about COVID-19, including its signs and symptoms, diagnosis, prevention, treatment, complications, and long-term consequences. I obtained this information from reputable Australian sources, including Health Direct Australia, the Australian Government Department of Health, Disability and Ageing, and the Australian Centre for Disease Control. I chose not to use the AI-generated information directly in my infographic because much of the information provided was sourced from American organizations and therefore may not fully reflect Australian health guidelines and recommendations. Instead, I relied on the information I gathered from Australian resources, as it had been published or updated within the last year and was provided directly by Australian government health authorities. Additionally, the information from these sources were presented in clear and accessible language, making it suitable for my target audience of aged care residents. Using Australian government resources helped ensure that the context in my infographic was accurate, current, relevant, and easy for the intended audience to understand. I used Canva to create my infographic poster. I selected a template that was visually appealing and easy to read, ensuring it would be suitable for aged care residents. I customized the template by changing the color scheme to green and adding images of germs to reinforce the topic of COVID-19 and make the poster more engaging. I then organized the information under clear headings and inserted the context I had researched. The infographic uses bright colors and relevant images to attract attention, while the layout presents the information in a clear and structured manner. This allows aged care residents to easily locate and understand important information about COVID-19, including its symptoms, prevention strategies, diagnosis, treatment options, and potential long-term effects. COVID-19 infographic poster for aged care residents. Pathophysiology. COVID-19 develops in the body by spreading through respiratory droplets and binding its spike proteins to ACE2 receptors on human cells, primarily in the nose, throat, and lungs. The virus then injects its genetic material, hijacks the cell machinery to replicate and destroy the host cell as it spreads. The symptoms include fever, cough, sore throat, shortness of breath, changed sense of smell or taste. Diagnosis. There are two types of tests that can show if you have COVID-19 virus. Rapid antigen tests, RATs, or polymerase chain reaction tests, PCRs. Both tests involve a nasal swab, a test where a long cotton bud is gently inserted into your nose to collect a sample from the inside. Treatment. Self-care measures include getting lots of rest and drinking plenty of water to avoid dehydration. Your urine should be pale yellow. Medicines for COVID-19. You can manage mild symptoms with over-the-counter medicines such as paracetamol or ibuprofen. There are two antiviral treatments available for the treatment of COVID-19. Paxlovid, Lagevrio, and Veklury, which is available in hospitals. Your doctor may recommend antiviral treatment if you are at risk of severe illness from COVID-19. Prevention. The best way to protect yourself and others against COVID-19 is to get vaccinated and get your regular boosters, stay home if you are sick, maintain physical distance from others, maintain good hand hygiene and respiratory hygiene, including washing your hands, wear a mask, avoid contact with people who are in high-risk groups. If you are sick, avoid visiting high-risk settings such as hospitals or aged care homes if you are sick. Complications. COVID-19 continues to circulate and cause serious illness in Australia. Each year in Australia, COVID-19 causes around 2,000 to 5,000 deaths, 110,000 hospitalizations. Long COVID is the name given to the ongoing symptoms that affect some people after having COVID-19. General symptoms such as fatigue, weakness, and pain, respiratory symptoms such as shortness of breath, ongoing cough and chest pain, cardiovascular symptoms such as chest tightness, heart palpitations, and symptoms of POTS, neurological symptoms such as memory loss, difficulty concentrating, and loss of smell or taste, gastrointestinal symptoms such as IBS, diarrhea, and constipation, mental health symptoms such as anxiety, depression, and insomnia. Through completing this assessment, I learned that while generative AI can be a useful starting point for research, the information it provides is not always specific to the intended audience, location, or nursing context. Much of the information generated by ChatGPT was sourced from American organizations and reflect American health guidelines and practices. This highlights the importance of critically evaluating AI-generated content and verifying information using reliable local sources that are relevant to Australian healthcare practices. One of my strengths during this assessment was designing an infographic that is visually appealing and engaging. I used bright colors, relevant images, and a clear layout to attract attention and encourage aged care residents to read the information. I also organized the content under clear headings to improve readability and understanding. A limitation of my infographic is that some of the font size is quite small. Due to the amount of information I wanted to include, it was difficult to fit all the content into a single poster while maintaining a larger font size. As my target audience is aged care residents, larger text may have improved accessibility for individuals with visual impairments. If I were to complete this assessment again, I would consider reducing the amount of information included or using a larger poster format to improve readability. Thank you for listening.